It's National Eczema Awareness Month, and also a wonderful time of the year to start prepping to take care of our skin during winter months. So what I want to do is talk about eczema and skincare. This is a really big part of eczema treatment. There are also a lot of prescriptions that are really helpful, so I always recommend that you schedule with your local dermatology group. But I just want to talk about skincare and how we can keep the flares at bay. So when we're talking about eczema, there are two main factors. One is that the skin barrier is disrupted and too much moisture is being let out. The second is that it can be very environmental, and this is where a lot of the itching can come from. So eczema is truly like asthma on the skin. We all know what can cause an asthma flare in our lungs, where our skin is susceptible to the same environmental factors and allergens as well. So some tips for eczema: we want to moisturize as much as possible, and the thicker the better. When we think about heat and water and what this does to our skin, it's going to really dry the skin out. So when we are showering, we want to make sure that the water is lukewarm, that you get it as cool as possible, and you only stay in for 5 to 10 minutes. When you get out of the shower, you have about a 3-minute window that you need to moisturize. You towel off a little bit, leave some water on the skin, and then use a thicker moisturizer to rub in with the water on the skin. And you'll find that it's not as thick and greasy as if you were to do it when you haven't just showered. And also, the skin's going to absorb it very quickly. So I usually say by the time you go to put your clothes on, it's already absorbed into the skin. So this is going to help eczema patients, but it's also going to help anybody, especially during winter months. Dry skin is truly itchy skin, and so we want to go ahead and try to prevent it by limiting the amount of heat and water on our skin, and also adding moisture back to the skin. So some other tips: bleach baths. If you are super itchy, you can put 1 to 2 capfuls of bleach in a tub of water, stay in for about 10 minutes, get out, and then moisturize as much as possible. 1 to 2 times a week. Obviously, if you use too much bleach, it can dry out the skin, but this is extremely diluted. Bleach helps kill some of the bacteria and yeast on the skin, or at least keep it at bay, not necessarily kill it. But part of itching can come from that bacteria and yeast. Also, if you think about having a compromised skin barrier, that means that there are cracks in it. And so it's going to be more susceptible to getting some secondary skin infections like warts and molluscum, and even something called impetigo, that's a superficial staph infection. So that is a trick, again, for everybody. If you're super itchy, you can take a bleach bath, then moisturize after, but especially for eczema patients, it's going to have that added benefit of kind of keeping some of these organisms that are on our skin where they need to be and not causing more problems. So the other thing is, you never want to touch your skin with your fingernails or your hand without having something between your hand and your skin. So this is like moisturizer or prescriptions. I really recommend, scooping out some aquaphor or any type of lotion and rubbing it on the skin. So instead of scratching with your nails, you can hit your skin, you can tap it, you can rub it, or you can even massage it in. That's the term I prefer. Some other tricks are, you can put these moisturizers in the refrigerator, and the cooling sensation will also help trick the brain, just as these other techniques will. So one of my favorite moisturizers is an aquaphor spray, because it's in an aerosol can, and so when it comes out, it's a little bit cool, but it also gives you a really thin layer. I really like that one when you get out of the bath as well. Some other tricks are just going to be making sure that everything is fragrance free. So this is going to be body washes and lotions, anything that touches your body. So if you think about clothes, especially your sheets, these all need to be with fragrance free detergent, fabric softeners, and dryer sheets. Favorite moisturizers. So like I said, the thicker the better. Just a good tip when you go to the store is, if it has a screw top lid, then it's not going to have as much water in it because it's not in a pump bottle. So I really recommend Vana cream. My second favorite is Aveeno. Just make sure that it's scent free. Dove, Cetaphil CeraVe, it's personal preference. One thing to keep in mind is that if it says eczema on it, it generally means it has colloidal oatmeal in it, and some people have an oatmeal allergy. If you have eczema, then in general you are more susceptible or typically have a history of more food environmental allergies. So some people find out the hard way that they have an issue with oatmeal by taking an oatmeal bath. If you stick to fragrance-free, especially Vanicream, then you're all good. So these are some tricks that are great for everybody. If you have eczema, make sure you check out the National Eczema Foundation at nationaleczema.org, and make sure you also schedule an appointment with your local dermatology group, because there are so many great prescriptions. There are also new ones that are coming out. So if you're 18 and older and you've just been told that you didn't outgrow your eczema and you have to live with it, there's a lot of hope now. There's a lot of research that is creating new drugs and treatment options. So I hope that this is helpful, and remember to limit your long hot showers during the winter and moisturize as much as possible, and the thicker the better.